Very nice to be back to Arab Health here. Yes, I'm Habib Nameh. I am the Executive Vice President of the Emerging Markets and as well Japan and Asia Pacific. What we are showcasing here in Arab Health is the edge of the technology in cancer treatment. We are in the precision radiation medicine. Elekta has been 50 years in this domain, in radiosurgery, in internal and external beams of radiation medicine, and as well in informatics. So we have like a large spectrum of solutions of precision radiation medicine, and more recently we have launched the Harmony linear accelerator, which is a perfect fit for the emerging market in terms of clinical application and serviceability, operability, and connectivity to the medical and the oncology information systems. We are as well, developing more and more the MR LINAC that last year when we showed it, it was we were at the 65th system sold. This year we overpassed the 100 systems sold, and this is a revolutionary technology where we have the imaging online, adaptive planning when we are treating the tumor. So we are showcasing it as well. Which is in a way much more concrete now, as we have 4 systems installed in the regions. And the other one is the brachytherapy. The brachytherapy with the internal beams. Elekta is a large manufacturers and worldwide leader in the brachytherapy, especially that the mix of cancer in the regions still have cervix in some developing markets, cancer, which benefit from the treatment from brachytherapy. Definitely we are developing and upgrading more and more our capability in neuroradiosurgery, in the gamma knife. Most importantly is the mosaic, the informatics, which is the glue in all these modalities, and transferring the data from all the departments of cancer treatment in the hospital during all the pathway of the patients, and more importantly, now we are engaging the patients through the Kaiku software in the treatment. So we have in the Mosaic platform the Kaiku software, where we interact with the patients after the treatment and give back to the tumor boards as well the informations from the patients as what are the consequences, what are the symptoms, and we're putting the patient at the center of the treatment. Exactly. I mean, in the beginning of the pandemic, nobody imagined that it will be that long, but definitely our service engineers, our application people who ensured during all the pandemic that the serviceability of the equipment is there and that the treatment is continued. Our clinical application were always on the field or through digital trainings to ensure that there is no disruption of the treatment of the patients. So the response was very heroic, I would say, from the engineers and from the application, and from our commercial team. They showed big resilience, and they didn't cut the communication with the customer. On the opposite, we adapted the digital platforms, and we ensured that we have continuity in transferring the chain of values of our solutions to our customers. So it was tough, but we learned a lot of things, and we kept developing the market. And Elekta has grown by 18% on orders during the COVID, and we as well grew in revenue. So I think what does it kill you make you stronger, and we are stronger. In the new normal, we learned a lot during COVID, and what we learned and what we'll continue doing it in the new normal is the productivity, the efficiency through the digital platform, that we can reach out to many stakeholders through the digital platform and transfer value. What we will do more and more is to accelerate the localization of our resources, because now for the mobility of cancer treatment, the patients wants to stay where they are. in each country. So we see acceleration of the infrastructure build-up locally, and this is something that will take it. So it's two ways. There's the digital platform to reach out more remotely, and the localization to build a local infrastructure for the patient to get the treatment locally. And this is what we'll continue to do.